Hello, class and professor. My name is Trevor Peck, and I am part of Group 2, and I will be going over Part 4 of our case study, the review and summary. This is a case of Gelsemium elegans poisoning, and over on the far right, Table 1, you can see a summary of previous cases that have involved this type of poisoning. Only one was a homicide that was way back in 1908, and there have been several mistaken ingestions and then a couple of suicide attempts by using this particular plant. This plant is native to Southeast Asia, typically found in China, India, Indonesia, Malaysia, Thailand, and Vietnam. It can be mistaken for other plants based on how it looks. There are other therapeutic herbs that look like this plant in that part of the world. There is an alkaloid contained in the plant called gelsamine, and that is what you see on the bottom right, the chemical structure. This alkaloid actually does have some therapeutic use to alleviate chronic pain, but the plant stems and leaves have found to have contained up to about 120 other alkaloids, and many of them are toxic and even fatal. So in this specific case, a 26-year-old woman was found comatose and immediately brought to the emergency room. She was intubated and put on a ventilator. Eventually, she regained consciousness and her vitals did return to normal within just a few hours. She was hospitalized for 11 days and eventually weaned off of any mechanical ventilation and anything like that. Behaviorally, she presented with euphoria and some childlike behaviors, but she had no memory of how she went into the coma. They did attempt to get a verbal history from both her and her husband several times, and eventually her husband remembered a bottle of herbs that were by her bedside. So samples were taken of those herbs and analyzed at a lab, and that confirmed the presence of the Gelsemium elegans. At that point, based on the analysis and her symptoms, they established that the poisoning was the reason for her coma. About a month later, the euphoria finally wore off, but the patient exhibited symptoms of depression, and she was discharged from the hospital at this 1 month period. She did have a follow-up at about 3.5 months post-coma. And at that point, she admitted to knowing about the herb in the mixture and its toxicity, and also admitted that an antidepressant had been added to the mixture. Generally speaking, it's kind of like things that you would purchase here in the United States. You would want to vet the supplier, and if it was just a neighbor or someone collecting the herbs and then grinding them down, then it's going to contain all of the alkaloids, including the toxic ones. But if the gelsamine is separated and purified, then that can be used for actual therapeutic and pain relief. The study conducted did suggest urine testing as a diagnostic test because the alkaloids will be present in the urine for a short amount of time. But this type of test obviously is not standard protocol for a urine test. So the recommendation was that it be done quickly because it can be eliminated from the body quickly, but also done anytime these symptoms might indicate this type of poisoning. Thank you very much.